Okay, let's get started. Good morning, everyone, and welcome to our 6th open forum on people analytics during the COVID-19 crisis. And today we are going to focus on healthcare. Very excited to have some amazing panelists with me, and we'll get to that in just a second. I'm Paul Rubenstein. I'm your host. I'm the Chief People Officer at Visier, and I'll explain how we work this in just a second. But first, I want to give you a couple of reminders. Why do we do this? This is about bringing the people analytics community together, sharing practices, sharing information, connecting people with resources. We've been really fortunate to have on lots of speakers who have shared their methods, practices, resources, etc., on how to and connect with each other for help. And, you know, as always in these meetings, it's about sharing the love. People need community during these times, and People Analytics has always been an amazing community. We want to keep that going. Next week, part 2 of a discussion on SMB and how small businesses are using people data. And then on May 20th, a deep dive into diversity and inclusion. What's happening in that area during the pandemic? We've got an amazing lineup also for that one. And, you know, we're going to really dig into what does it mean and answer this biggest question that Lexi Martin and I talk about a lot, which is, with all the great things and advances we've done in diversity in the last 10, 15, 20 years, will that be eroded by this crisis, or is this a time to double down? So look forward to that. And then we will also be doing a version of the People Analytics Forum during Visier's first virtual conference. And you don't have to book a plane flight. This will be my first time participating in such a large virtual conference. If you've been to Outsmart before, it's not just about Visier. It really is about people analytics. Everyone is welcome, whether you're a Visier customer or not, and you can find out more information down there below. So let's get to it. Today's lineup: Gary Russo, Dan Lapporte, David Hashemi. And we are going to, we've got an exciting set of really, what is going on in big healthcare. If you have a question for the speaker, there's a Q&A tab. Just click on that button, type that question. It can be a question for a speaker, for any speaker, or a general question that you want to have answered. Put it there, and we will respond as quickly as we can. In the chat, we're watching the chat. People tend to share resources in the chat, but if you do have a question, please put it in the Q&A. And if you want to present at an open forum, please just let us know. Send us a LinkedIn, send us a message. You can direct it to either Lexi Martin or myself, and we're happy to have anybody on. So let's get right to it. Did I stop sharing my screen? Awesome. So nowhere is this more important than in healthcare, the use of people analytics during this crisis. This is not yesterday's people analytics. This is people analytics pushed to the brink, where the data is used to help keep workers healthy, right? Important choices around keeping workers healthy, important choices about delivering healthcare to the system. This has a human aspect, it has an economic aspect, and we see it, we all watch the news about how our hospital systems were stressed or preparing to be stressed and responding. I don't know, in January of last year, I remember sitting watching the Johns Hopkins dashboard and saying, what is this? I was with one of my colleagues, Dave Weisbeck, and we're like, oh, this is a thing, back when it was like triple-digit numbers. And then all of a sudden it was a big thing, and we were like, wow, this is world-changing, this is life-changing. So let me start with you, David. David, do you remember what it felt like being in healthcare, being in people analytics in a healthcare organization? Do you remember what it felt like when it first hit? How did you know that this was different? And David, why don't you introduce yourself first?
Sure, absolutely. Thank you, Paul. So David Hashemi, I work for CommonSpirit Health. We are a faith-based healthcare provider. We were actually formed early in 2019 out of an alignment between Dignity Health and Catholic Health Initiatives. So as an organization, CommonSpirit Health is fairly young, which has been interesting to be going through this crisis at a time where we're still coming together from a systems and process perspective. We operate in 21 states. We have almost 150,000 employees. So very, very large organization. I myself, David Hashemi, I am the system director for People Insights. So we run essentially the people analytics portion of the HR analytics function for all of CommonSpirit Health. And the Dignity Health headquarters, which is where I work out of, is located in San Francisco. San Francisco and Washington were two of the initial hotspots for COVID in the United States. And it hit us hard, it hit us fast. I remember very, very early in March, we actually got an email from the chief medical officer saying that a potential COVID case had come onto our corporate campus. And that as soon as that happened, we had to go ahead to start working from home. So we've actually all been remote for quite some time now. But it was clear immediately that this was something in our backyard. This was something that was going to be impacting every single one of us. And the wheels started turning right away to start risk mitigation.
What was the first question you think you got asked from a people analytics perspective, at the beginning of the crisis? Do you remember that first question?
Sure. We tried to be pretty proactive. And as soon as it became clear that this was something we had to take seriously, the analytics team began reaching out to HR leaders. So it was more of a push at that point than a pull. And the first question we got asked by HR leadership was, we need to understand who is at risk of not coming to work tomorrow. And there were so many different ways of looking at that question and answering that question. We worked to get our arms around as many different nuances and elements of that answer as we could.
Who is at risk who is at risk of not coming to work tomorrow? That was the first big question. Yeah, I mean, think about it, that makes perfect sense. Gary Russo, can you introduce yourself? Gary?
Sure, thanks.
There you go.
So, hi everyone. My name is Gary Russo. Am I reconnecting?
You are all connected.
So I'm Gary Russo, Director of Workforce Intelligence at Providence St. Joseph Health. Providence.
Okay, that's working well. Dan, why don't you help? And Dan, you got to come off mute.
I think that was good time.
There you go.
All right.
Okay.
Can you hear me now?
Yeah. So Dan, why don't we go over to you and we'll come right back to Gary. So Dan, introduce yourself.
Sure. Hi, everyone. I'm Dan Lapporte. I lead People Analytics at Kaiser Permanente, based in Oakland, California, just across the pond from David. I have been at Kaiser for about 8 years, and prior to that held similar roles at Chevron Corporation and also Charles Schwab. And my role at Kaiser is leading a team responsible for providing workforce analytics, people analytics, whatever we're calling it, to at the enterprise level. And then we have a sort of a center of excellence cohort around people analytics practitioners across the program. Kaiser is a pretty big place. We have 217,000 and change employees, not including physicians. And as David mentioned, COVID certainly hit us hard. It hit us fast, and we're in I won't say in crisis mode anymore, because we have definitely seen a flattening of the curve. But there are certainly Kaiser members in our hospitals receiving treatment. Some of those folks include our employees who have been exposed and contracted the disease. So this is really very unprecedented times. And I know we're going to get into some specific questions on it, but the demands on workforce analytics is really pretty strong.
How did you know, like, what was the first indication that this was a crisis? And what were the first sort of question that you had to answer or think about answering?
Yeah, for us, and it kind of gets to what David was saying as well, it was about segmenting the workforce, trying to discern who are those true frontline care delivery folks. It was being able to define who are the people supporting them, lift technicians, and maybe, respiratory therapist aides. So a lot of it was really trying to understand where we had certain segments of population, and potentially, like a lot of other large companies, full disclosure here, our job family and job titles are not the best at doing that. So it was a bit of a detective work and a bit of effort to try to get those populations nailed down for decision makers.
I want to dig into that in just a little bit, and let's talk about how the data did or did not support our efforts. But let's also introduce our final panelist, and let me ask you the same question. Gary, introduce yourself with your new internet connection.
I know, new and revised. So, hi everyone. My name is Gary Russo. I'm the Director of Workforce Intelligence at Providence St. Joseph Health. We're also based in the Northwest, based in Seattle. And we have hospitals and physician enterprises across 7 states along the West Coast, ranging from Southern California up to Alaska. We have about 120,000 employed workers, plus a whole cohort of contracted and associated workers as well. So similar story to those on the phone with me. We were hit very quickly. So a Providence hospital treated the first COVID case in the United States. And really, it has been a wild ride since that first week. So as we go into more detail, I think the take home and the first questions that we received, we are, I say, blessed to have a series of professionals and experts. One of the first quotes I heard is that we deal with emergencies all the time. This one's called COVID. So we had the people on the ground doing a lot of the hard work from day one, and then our role has come in to support. The first questions not even being from a people perspective, but we learned our lesson from, let's say, Italy, and do we have enough masks? So if we were to have a crisis, how many caregivers need masks? How often? What does that look like from a supply perspective? So we kind of got new contacts reaching out for the first portion of this crisis.
It's interesting, and when we think about the importance of people analytics, before the crisis, one of the biggest debates was how can we have the head count accurate for budget, right? And reconcile that. And, that is not a life or death situation, but the notion of being able to understand how many people we have to be able to enter into a constrained supply of masks, and who should get them, and understanding the data for that ups it into a whole new level. And I mean, that's been one of the biggest lessons for me as I've talked to the healthcare organizations. Let's talk about the questions that you were answering. How many people? What do they do? Who's not going to show up at work? Dan, let's start with this segmentation. You and I talked a lot about something simple like job codes. How did you determine who was a frontline worker and an essential worker? And tell us a little bit about your remote work identification.
Sure. Yeah. So early on, because counties at the county level here in California were declaring these shelter-in-place requirements, the initial segmentation was just geography. So we needed to understand how many people lived and worked in Alameda County, Contra Costa County, whatever. That was table stakes. That was pretty easy. The next question was, well, of those people, how many of them are working in medical centers? Because to Gary's point, having the appropriate personal protective equipment, PPE, is vital. And so a lot of questions revolved around how many masks do we need? And then the questions really started getting a lot more specific. So there was a concern early on around cash handling and credit card handlings, because if you have a member who comes in sneezing all over their wallet and then hands somebody their credit card, that was a concern. Sorry, that might have been a little graphic, but nonetheless,
the reality we live in.
The question was, how many of our folks handle money? How many of our people handle credit cards? And that was not so straightforward. There is no field in any ERP that I'm aware of that says you handle money. So that was a bit more like detective work, where we had to look at the job families, the job codes, maybe segment people by location or job role. And through kind of fitting those people into a particular puzzle, we were able to say this group are the ones who are handling cash. And it wasn't, as simple as cash handling clerk. It was, there may have been a lab analyst, for example, who was receiving a copayment from a member or something like that. So that was sort of going from the high level down to the very granular. And once we created those lists, it was fairly easy to maintain them, to be able to say, what is the effect? Have we seen, we're not tracking, anything that would be considered PHI. We're not tracking infections. We're not tracking people who come down with an ailment, but we're certainly tracking those people to understand, are they taking more leaves? Are they turning over more quickly? What are the behaviors of those employees?
That's interesting. This notion that our job codes, which we spent, think about the hours that we pour over a job description to make sure it, serves us well. And then when it comes to crisis, it didn't have the data that we wanted. Gary, you also talked about, part of this is who does what work and how can we redeploy work. Can you talk a little bit about your journey on understanding people's skills and where we can redeploy?
Yeah, happy to. So we had a similar starting point in that we had a lot of jobs. The job codes, the way we handled this typically didn't answer any of our questions. We were trying to adopt a team-based care model that we had partnered with our critical care specialist about. And that called for anyone who could operate a ventilator, anyone who had ICU training, anyone who could step away from a different bed of care and go work in an ICU for like a critical COVID patient. And what that meant was we couldn't just rely on job titles, which frankly, we never had great luck with when it came to specificity. But when it came to who else could step in to fill the vacuum when a different nurse moved over, we didn't have a great lens of other skills that people had that weren't attached to their direct job title. So what we wound up doing is we created a survey. We partnered with our clinical leads and experts and teamed with our HRIS department to create a survey that asked, are you actively licensed in one of these 11 critical care jobs? And then if you're not critical care, if you're not an active caregiver, are you willing to push a vacuum to help clean? Are you able to do other tasks that we might be pulling into other parts of the organization during a crisis? We sent this out via success factors. We used kind of modules that we'd never really touched in years. Huge props to the greater team beyond me that worked on that. And we got feedback from over 80,000, I think at this point, of our caregivers who came in and said, yeah, I'm an ICU nurse. I was an ICU nurse. I am skilled. My license is lapsed because I'm an admin now. But we took that direct feedback, and we actually used that to correct and bolster our kind of guesses from segmenting on our jobs and our job families and our kind of a typical approach.
You know, the first observation is, you know, I bet that was one of the fastest deployments of software you've ever seen. It's amazing, you know, how do we, you know, we draw these problems, but it turns out we could do that much faster when we have a, you know, a literal crisis underneath. The notion of skills, right, though, and its skills inventory is, what about the licensing aspect, though? Like, you know, because in a high standard, it may be that I know how to do something, I have the will to do something, but am I licensed to do it? How did you deal with that aspect of it?
So especially for folks who may not be in sort of a heavily licensed industry, it's very specific. So you need to have very specific national or state licensure to do certain types of care. So that was a critical component of, well, what if they can't legally do the work? And we always get hung up because a lot of the skills and certifications may not be legally required for a job, which means it's harder to continue to keep those up to date if you're trying to keep up with legally required licenses. So what we did is we kind of did a shared model in which part of that survey was, if you're licensed, if you have a license for this, can you just tell us what it is? If you know the expiration date, let us know what that is. You know, information that you have, please volunteer that, so that what we were able to do is supply a list. So every caregiver that participated and said, hey, we could be a part of a critical care unit, that list can get sent out to the various labor pools in our local hospitals and geographies, and they can go, oh, it's time to pull that lever of I need additional support. Here's my short list of people that have self-identified. I already kind of know what their licensure is, to save that step on formally verifying that they are able to do those tasks.
Yeah, this notion of where do I, in a crisis, if I just, you know, scream, somebody help me, it's much more effective to know, oh, this group of people are the most likely to help me. Let's start there, right? So, you know, often people confuse the precision of a report with the nature of analytics as pointing you in the right direction for an insight, right? You know, and I think people get hung up on that. How did you, how are you going to keep that going forward? I'm curious. Like, where does that, how does that influence your thinking about skills in a and skills inventory in a post-COVID world?
You know, the short answer is it was so wildly successful. So the good news is we had an opportunity to use a system that we sustain, and it was designed to do this sort of thing in the first place. So all the information is saved, step one. Step two, it worked so well that as we think forward about how valuable that was, we now have work to say, this worked, how do we do this again? So the same survey of what type of skill can you do was immediately applied to all of our new caregivers who were being hired and joining. We want to make sure that was complete and shown to everyone. So really, it's just a matter of keeping it, adding more questions, working with those business contacts to say what matters, and then just keep bolstering that kind of extra data set on top of our traditional HR list.
So speaking of extra data sets, one of the toughest data sets, you know, out there is, you know, time data, right? People cost data, and, you know, what comes first, the payroll or the timekeeping system? David, can you talk a little bit about your journey in that arena?
Absolutely. And it's been quite a journey. You know, the first question we got asked was about who may not show up tomorrow. The second question we got asked by a cross-functional team supporting our executives and supporting our incident command centers was a really simple one. It was, who isn't showing up to work? And, you know, the situation on the ground every day was changing dynamically. The incident command centers every day needed to have an up-to-date understanding of absenteeism, an up-to-date understanding, if it was available, of, you know, for those who are absent, when may they come back for planning purposes. And so we went on quite a journey into our timekeeping data. And one of the things that I guess I always knew, but really got hit home for me through this journey, was many of our systems are set up primarily for administrative purposes, and analytics are a layer that we work off of from these systems, but they're not usually primarily set up for analytics. And our experience up until the crisis with payroll data was coming from our payroll systems. It was looking at data that had already been closed out and trued up and accounted for late clocking events and things like that. So one of the things that we spent a lot of time on was digging into that real timekeeping data from our timekeeping systems, which I should add, being an organization that's just come together about a year and a half ago, we're still on multiple timekeeping systems.
Yes.
So a big part of the role that our team played here was bringing together data from different systems, harmonizing that data, understanding that process and really system configuration were not set up for analytics, but for administration. One of the big things that we learned very quickly was the timekeeping codes in the timekeeping system didn't answer the questions about why people were out to the level of specificity we needed. And that level of specificity was coming in through open-ended comments that were getting appended to the clocking records. So one of the many things we ended up doing was putting together some code to scrape that open-ended text and look for keywords, using those keywords to categorize time into different COVID-related buckets.
That's amazing. So in the middle of a crisis, you're scraping open comments to get the pattern analysis on why people are really out sick.
Yeah, we rolled up our sleeves and did anything we had to do to get the insights that people needed. And honestly, it was a team effort. That was the case across these cross-functional teams, which is really exciting to see. It was busy. It was hectic.
So each of you have told me stories about the diversity of data increasing, right? The sources, the number of sources that you have access to, and working collaboratively with other parts of the organization. So let's, David, we're with you. How has this changed people analytics, your people analytics group's interplay with other organizations, with other parts of your organization?
We're working much more collaboratively. I think that I referenced the incident command centers, which were being fed data from a cross-functional team. And I think there's been a broad acknowledgement that every analytics function paints one piece of a broader picture. And the way we work together, the way we defined who is responsible for what, was another learning coming out of this process. You referenced the Johns Hopkins data, which is good for a general understanding of case trends, but we work in healthcare. We have a clinical informatics team that, their bread and butter was around predicting cases in our hospitals. So understanding that we have a team focused on that, and the insights that come out of that team need to be the single source of truth that we all react to. That kind of understanding was built across every function. So in the people analytics space, understanding data about what staff do we have on hand, understanding projections about how many people we expect to be absent based on looking at trends in the markets that were hit harder earlier. That came out of our team, and there was an appreciation and an understanding for the role we all play and how all of our insights come together to paint this picture of case demand, supply from a supply chain perspective, from a beds perspective, supply from a staffing perspective, and how they all come together. And I think that collaboration is going to continue going into the future.
Harry, can you talk a little bit about collaboration and how that may have changed at Providence?
Yeah, so I guess the good news is that I didn't meet new portions of the org. So a personal journey had been making sure that we connected with as many parts of the business as possible. What I did do is meet a lot of new people representing those portions of the org. So real estate had its own questions, supply chain, our whole nursing arm, especially around our critical care. A lot of focused experts came together into these crisis centers and these project teams to make sure that we were all kind of looking at that laser focus of one ideal set of data, one strategy, one approach. I think as far as diversity of teams, the thing that really stood out to me is that there were new faces being brought up and brought into these teams strictly based on they were passionate and they were talented and they were available and they kind of answered the call, to use Providence language, to join. So we had a lot of opportunities where there was a broad open question of, we really need to solve this problem. Who can help? And we had analysts, we had folks from our strategy office that typically didn't work in that line of work, but they became stars and bright spots on these teams that you didn't really get an opportunity to see them kind of take a project and use that intrinsic motivation to deliver on hourly time schedules. So I think it was a really interesting form of collaboration where people got to sink into their comfort zone and have the trust and autonomy to just go do. And we've had some crazy successes just because of that approach.
Dan, what about collaboration at Kaiser?
Yeah, I think what David and Gary was saying really resonates with me. I've been saying for a while now that this crisis is bringing out the best in some, the worst in others. And the best is some of that collaboration, some of that teamwork, and really, to Gary's point, just meeting new people across the organization who are all focused on either delivering information or delivering outcomes or results that the organization needs to move forward. Maybe it goes without saying, the worst people are the toilet paper hoarders or someone like that, who are, you know, not recognizing that this is really a global and historic event that we're all living through right now. More to the point around Kaiser, we are a large organization. We are very segmented, and that segmentation historically has led to what I would call silos. There's a lot of people who like to kind of stay in their tower and not play, and data is power, particularly workforce data. Those silos fell down. We have really seen a lot of engagement across our regions, across our functions, and it's been pretty inspiring. And I think that it will live on as we move out of the worst of this crisis and into recovery and returning to a new normal.
That's helpful. I want to just remind the audience, if they have questions for any of the panelists, you can just type that in the Q&A box and I will direct them as appropriate. I want to go back to something tactical again. We've seen this across our entire base of customers at Visier, the need for speed, right? Getting things done faster, and the frequency of data, right? The frequency with which data is loaded. Toss-up question, just raise your hand and I'll call on you. Did you change the frequency with which you were consuming data? And can you talk about it a little bit? Dan?
Yeah, absolutely. We had been sending data, and I'll talk specifically about Visier, but we had been sending data on a monthly basis, which I think some of your customers do. We very quickly, and to Visier and the internal Kaiser team's credit, transitioned to a weekly feed of data. And the reason for that probably goes without saying, but having more actionable and accurate information was something that was demanded from the C-suite. Things are changing maybe day to day, maybe hour to hour, certainly week to week. So our monthly refresh cycle was not acceptable. And within 3 weeks, maybe, we made that transition. So we're sending tons and tons of data on those 217,000 plus workers every week to Visier. And the outcomes and information already, we've gotten some praise from our leaders about making that transition.
Yeah, you know, the scale is not lost on me here. You know, having CommonSpirit, Kaiser, and Providence. You know, I think we're approaching, if you add all in the affiliates, what, 1 million employees, and I can't even begin to guess what the footprint of patients, sorry, communities served here. I mean, it's this is a tremendous impact here. So that scale for each of you individually and collectively is huge. How did your team address the scale and frequency of data? Like, what'd you do? How did your team support this? Did you have to do anything differently? Anyone?
So, raise a hand. Raise a hand. So just to jump on. So I think one of the big data sizing things that we've tackled and been successful assisting our payroll department in particular, payroll data is notoriously large. So when you have over 100,000 people, 7 days a week, 24 hours in a day, people like to clock in 7 minutes in or out. So we're talking billions of cells. So, crashing Excel in a heartbeat. So when it comes to trending, when it comes to tracking pay codes, when it comes to trying to monitor progress, that can overwhelm even, a system designed to handle payroll data, because a payroll system is not designed to handle analytics of payroll data.
Right.
So as far as size and scale, we, being a Visier customer, but basically being able to use our technical skill and our infrastructure to take lots of data, make it meaningful, and then be able to handle large calculations and summarize things in a trend line, that has stepped forward as a massive win. When people didn't need that 3 months ago necessarily, it didn't matter so much because they were more worried about this month versus last month, very snapshot in time. Now, just being able to handle big chunks of data, especially payroll, has really served us well as far as delivering value to the organization, but getting those insights that are much more just in time.
Anyone else, David?
I echo a lot of what Gary is saying, and we did move, especially with the timekeeping data, to daily updates. So, those were insights that the incident command centers needed in that just-in-time, on-the-ground framework. I think that the value proposition for our team really grew through this crisis, because instead of having each of the HR teams who are very geographically dispersed, who have very diverse skill sets, but who were all being asked to provide similar types of information to their local incident command centers, it was clear the role that our team could play from a more centralized system level perspective in putting together tools and resources and a process that we could then redisseminate out across the system and take that burden away from the local HR teams. So, the nature of our work has changed in that way. We got scrappy. We stepped forward immediately and said, anything that you guys need from a data perspective, and this can be capital A analytics, or it can be data wrangling, and it did turn into a lot of data wrangling around the pay data. We will step in and support, especially knowing that the local HR teams were just inundated with handling individual employee cases and transitions to leave management, transitions to benefits management, and that kind of thing. We became sort of enablers of the local HR teams by taking that work off of their shoulders.
Well, let's talk about consumption for a second. How do you, so you're in a center, you have lots of people of varying skills that have to quickly consume this people data. Tell me, how did you get it to them? Was it Excel? Was it Tableau? Was it a PowerPoint? Was it Visier? Was it PDFs? I mean, how did you get it to people so that they consume and take action? Given that you can't send everyone to sort of an analytics training course in the middle of a crisis. Anyone?
Yeah, we provided so the C-suite, quite honestly, prefers, at least at Kaiser, prefers static views. They're not into kind of drilling and the detail required for that. So they did receive or are currently receiving weekly PowerPoints. However, the folks up to the VP level supporting them are definitely receiving Visier, in our case, analyses or slideshows. And then they are drilling into and answering all those questions that, one question follows another. So if you can show people where you've got clinical folks by region, the next question is, well, where are clinical folks by facility? So, in that regard, for us at least, Paul, Visier was incredibly powerful and beneficial.
So static view at the executive level, dynamic, clickable, sort of answer your next question at the supporting level.
Yeah.
Gary, I saw you raise your hand there.
And I think it's a similar story. For our executive, especially for things where immediate action doesn't do anything. We have a very actionable storytelling approach where possible. So if we're mostly monitoring who's using what, if we're trying to figure out if people are utilizing an emergency program that we've set up, there's really big take-homes of what have we done, what are we doing next for the executives. That's a slide. In many cases, it's a coming together of many COVID-related activities to summarize everything, so that our chief people officer can walk to the executives and say, here's how it's going. We do use Visier to distribute kind of reporting level information so people can go fetch and find. But we've also had to step outside of our fancier tools. We leverage Tableau where possible, but we also use Excel in this particular crisis because it's like the blank canvas. If you need to do a crazy calculation with new data you never touched before, welcome back to it. So we have an internal Microsoft Teams installation, so we've been leveraging internal groups that we can kind of protect via membership, so we don't send out private information everywhere, but everyone comes to one place and accesses the same file. So it's really we've been focusing first on what is it you need, and then what do we do to support that. And I just want to comment that the power of no in a crisis. There have been things where we've been asked, we need a daily update on this type of clock in, clock out information. And the answer has to be, we can't get you that because we don't have a culture that clocks that sort of thing every day. At the end of 2 weeks, they're going to get pinged because they didn't do it right. They're going to correct it. So the reality is that creative no's in a crisis have been, or diplomatic no's, not creative, have been helpful because you're not going to get the outcome you want through this means. You should go figure out, or we can consult with you and help you figure out a better way of doing it. Because they need to get an answer, and it's hard to overpromise on data when the business activity doesn't support a right answer.
So Gary, you've opened up you opened up a can of worms. No, you've gone right to the heart of, I think, one of the big challenges in analytics and the evolution that we're seeing here, and what's sometimes slowing it down in some organizations is people not understanding what the information gathering process, right, and how it limits your ability to model data, right? So like what David said before, our systems were built for administrative simplicity, not analytic richness, okay? So all of a sudden these leaders are seeing, geez, if I had known I was going to be in this crisis, I would have made those decisions differently if I was thinking about our data structures tomorrow. And then the second one is, what is good enough? What is good enough accuracy to be able to make a directional decision, which is the nature of trends and predictions versus a accounting report. So what does this mean for the future? Are you going to, how will organizations rethink their data and analytics and what they ask people analytics for coming out of this crisis?
Just the quick answer comes right to mind. Maybe everyone else agrees. I think everyone has gotten a crash course in how scenarios work as far as the swing of predictions. I'm not entirely certain it was so common knowledge across the nation, the world, of just how crazy the future can look with very minor adjustments. I think especially given that all of our pretty, maybe sometimes stable historic numbers are a mess now, given COVID. We're all going to have to get used to and adapt to, what are our, high, low, and middle expectations in the future, and kind of operate inside of bands instead of clean lines.
There's something about volatility that makes you appreciate agility. I think about a huge part of our workforce at our company they graduated maybe in 2010. And they've never seen a bad economy. They've never seen a bad anything happen in their work lives. So, if you're used to it always being sunny and 68, you never contemplate what it takes to prepare for 34-degree weather. So, you know, it's been interesting. Other people, what are some of the things that, you know, that you've learned and some of the things that you've embraced during this crisis that you want to carry forward with?
Yeah, so in line with some of Gary's comments and with the prior question, Paul, one of the things that we transitioned into once we got the basics down, just providing answers to the questions people have, was looking at how we could put together different toolkits or different platforms that users on the ground could use, where, you know, our insights are delivered to them. The users then calibrate our insights with what they know about what's going on at the ground level and can start to do some scenario planning. So, you know, the second level work effort that we took on after the basics were done was essentially putting together a staffing planner, where we were presenting all the data about the workforce as we understood it from a systems perspective, absences as we understood them from a systems perspective, trends that we anticipated around increasing absence or that we were bringing in around increasing patient loads, and then opening up some variables for the users to do scenario planning, you know, letting them plug in different staffing ratios to look at, well, this is what our supply-demand equation looks like with normal staffing. Here's how it changes if we go to pandemic staffing ratios. Here's how it changes if we flex up some of the folks who maybe aren't working a full FTE. Here's how it looks if we bring in more travelers. So putting a tool out there that is grounded in a foundation of analytics, but that allows the person on the ground who has greater insight into some of the things that we don't see from a systems perspective to come up and calibrate and plan a few scenarios to start looking at what the answer to their question about staffing needs may be 1 week out, 2 weeks out. I think it's something that we're going to be more focused on going forward, is those two-way tools. How do we come together, analytics and operations, to come up with answers?
I love that. You know, I was always taught that, you know, the goal of analytics isn't to answer a question, it's to help people ask better questions. You know, what if I do it this way? What if I do it that way? So that's great. Dan, lessons going forward, things you want to preserve?
I guess the one piece that I would add to what Gary and David said is that intersection of operational data and workforce data is just the beginning. There are so many opportunities to look at outcome data. And I think that, you know, despite the chaos that the COVID pandemic, coronavirus pandemic is having, there will be an opportunity for a better collaboration, tighter collaboration, and that really, you know, sort of holy grail of being able to answer questions related to business outcomes based on workforce information. And I know that's been a sort of mantra that Visier has had for quite a while. I think the need is going to become ever present, and as we move forward, the speed to deliver those things will really differentiate the wheat from the chaff.
People analytics has gone from a nice to have to a must have. I mean, it's gone from what we used to say, it's gone from a vitamin that, you know, people would like, maybe I'll take it, you know, and read it later, to a pain pill. Like, I have a headache, I need this data right now. So that's been interesting to see that shift. Gary, things that you will keep going forward that you learned during this lesson, during the lessons learned during the crisis.
You know, I think the big take home is, if I am asked a question, I'm pretty confident that there's someone else smarter than me in the business or whatever owner of that question, they have an answer. And it's really about, how do we take that answer, scale it, refine that answer. And what I would mean by is, there's a lot of classic questions that HR tries to ask around skills, around what is the right type of work. There are people, boots on the ground, that do this work day in, day out. It could be finance, it could be IS. There are a lot of just experts out there. And the more you can collaborate and get those good ideas, you're able to answer those tough questions more efficiently and accurately, and you're building relationships inside of the organization at the same time, which if at the end of the day, if HR is going to continue to distinguish itself from another analytics team, it's building those human relationships at the same time that we're kind of using numbers to justify what we're doing next.
It's helpful. We're coming close to the end here. What's next? So what are you, how are you thinking about your, near and long-term planning, and what are you getting your team ready for, or what is the organization looking to you for? Gary?
It's not COVID 2.0, and I not in a sense, because there's always a question about, is there going to be a second wave?
Can we not call it 2.0? 2.0 sounds like an upgrade.
Maybe it's our upgrade.
Let's find another
Maybe
term.
It's our upgrade. Our response is there, right? So it's that return to normal, that return to work. Because in my mind, it is the same question as, what are we going to do if COVID gets bad? It's the same question, just what do we do as we return to whatever new normal looks like? And there's projections all over the board from different places about what that could look like, different jobs, different recovery of the economy in general. It's the same scenario planning of, what if business doesn't come back? What if it does, and it's a boom in business? As far as the folks in the audience may have heard the dichotomy, especially in healthcare, where we have empty hospitals that are prepared for a crisis. So it's what happens if we do or don't get our patients back in the next 2 or 3 months. So we have a very critical time ahead of us of what is normal and how do we support that, and then for our own workers and caregivers, how do we make sure that we're doing the right thing by them in this time of uncertainty? So that's our primary focus.
Dan?
I think Gary said it beautifully, far more articulately than I could hope to. But I think the other thing that is coming is the new normal will be very different than the old normal. And what that's going to look like with respect to, not only the business of healthcare, but the business of restaurants and retail and manufacturing and every other segment of this economy is going to be really telling in terms of how we recover as a society, as a country, and as a global population. Healthcare, for sure, is I'm hearing questions around, when will elective procedures come back? That's a bit of a moneymaker for healthcare, broadly speaking, and we're not doing a whole lot of that right now. The other finding, and I think it's going to be very impactful going into the future, is what we've seen at Kaiser is we used to be 10% telemedicine, 90% sort of inpatient visits. That has flipped. In many of our regions, we're seeing 90% telehealth, and that was sort of a springboard, or this shelter-in-place COVID coronavirus was a springboard to get telehealth really front of mind for people. So I think that's going to be an area of growth, and the requisite investments in that are going to be required across this industry.
And you also shared a very specific framework for thinking about the future. Can you talk about 2-6-12?
Yeah, in one of our regions, Southern California, the organization is looking at this recovery in terms of 2 months, 6 months, 12 months. What does our 2 month go forward plan look like? What does our 6 month go forward plan look like, and our 12 month go forward plan? And each one of those probably has similar considerations, but and ranges or scenarios that we might play out. But I think that framework is incredibly helpful to think about kind of compartmentalizing, if X happens in 2 months, how does that affect the 6 month plan? And if Y happens in 6 months, what does the 12 month plan look like? So that's a good framework to add a kind of a time dimension to the recovery.
Yeah, I love that. It reminds you of the zone of confidence when you look at hurricanes. Where will it be? You have to kind of prepare for many options, and it's a great way to think of it. David, what are you guys working on next? Like, what are you preparing for?
Well, Dan and Gary both spoke to a lot of the things that we're thinking about, and I'll also tip my hat to Gary, who very eloquently described that dichotomy in healthcare right now, which we're all experiencing. The one thing that I would add is knowing that there are so many different ways things could play out in the next couple of months. We are laying down that foundation for being able to be agile with our workforce. And that starts with going back to what Gary started talking about, understanding where there can be cross-pollination of staff, understanding how we can take our existing workforce and support a higher volume of telemedicine, because we're seeing that same sort of trend that Dan spoke to. And I think that our focus really needs to be now on maintaining the ability to respond in an agile way to whatever ends up happening in the fall, and making sure that the ways we react to this crisis don't hinder our ability to be successful later this year.
That's good. So thank you for that. There is so much more we could talk about, like how we're going to use people analytics to pay for all of this, the economic impact on healthcare organizations. We are at the top of the hour. I want to thank each and every one of you for contributing here. You've been public in your contribution. Gary, the staffing demand calculator that went out publicly, thank you. I know a lot of other organizations picked that up. And there is a tremendous kindred spirit we find among our healthcare customers. We are blessed to have all three of you as customers, so thank you for that. You know, all of your information will be up on the web. There'll be a rebroadcast, so be careful. People may reach out to you for this. So thank you very much, and my best to all of your teams and to your organizations. You are doing such important work. I want to just close with a couple of reminders. I'm going to share my screen real quick. Next week, we have the SMB forum. So we're going to be diving again into small businesses and how they are coping. And then on May 20th, join us for talking about D&I. Once again, Outsmart, you can register at visier.com/outsmart. We will be coordinating a open forum in conjunction with Outsmart. And please stay healthy, stay safe, stay sane. This broadcast will be up on Tuesday. If you want to send it to anyone, you can find it at Visier's crisis page. Thank you so much, and have a great day.